Hi, everybody. I'm going to talk about elder care and my experiences with it today. Specifically, ageism, elder virtues, and how nurses can reframe the experience of long term care for our aging population. Ageism is something that I have seen a lot of, from everyday language all the way to institutional practices. Locally, one place I've noticed it is when older patients came to the ER and are sometimes dismissed as just confused without a proper workup. I once had a patient present with sudden confusion, and I remember the department getting a briefing days later because she was not checked for an UTI for a long time, presumably because her confusion was dismissed as cognitive decline. At the state and national level, ageism shows up all the time in underfunded senior programs and policies that deprioritize elder mental health or social engagement. Even during public health campaigns, seniors often seem like an afterthought. As nurses, we combat ageism by advocating. We can challenge dismissive language, provide thorough care, and educate families and colleagues about the strengths and capabilities of older adults. Empathy and respectful communication go a long way. I've been fortunate enough to have meaningful interactions with older adults, both professionally and personally. One patient that I'll never forget was a woman who came in after a fall that she had at Target. Even in pain, she displayed incredible amounts of the virtues hilarity, detachment, and nonchalance. She just kept laughing that she had shopped till she dropped in the CT room while the nurses got an IV in. Another patient, a man in his 80s who had taught math at the University of Minnesota, came in for an arterial head laceration. It wasn't a large wound, but required direct pressure for over 30 minutes. During my time in the room holding the dressing, we talked about his years teaching, and it made a huge impression on me that he had lived out what was truly his calling and felt at peace with the life that he had lived. To me, he displayed the virtues of wisdom and benignity. Nurses can help cultivate these in elders by listening to their stories, encouraging autonomy, and recognizing their strengths, not just their limitations. Something as simple as asking about their past or giving them space to help make decisions about their care can restore dignity and purpose. Cohen wrote that many elders see institutionalization, not death, as the ultimate defeat. I've seen that fear firsthand. My grandparents had displayed cognitive decline for some time, and were at the point where my parents decided that it was time to transition to a nursing home. My grandma was wildly against this idea, but as we showed the facility, the amenities there, the proximity to us, and the autonomy that was allowed at this residence, she began to come around. She had been sure that any facility would be depressing and awful, when that is not the case. Long-term care doesn't have to feel like exile, but we need to fix the worst of these long-term care facilities that give a bad reputation. Nurses, especially nurses employed at long-term care facilities, play a key role in shifting this mindset. We can humanize care by building relationships, involving families, encouraging residents to personalize their space, and ensuring that they participate in activities that bring joy or meaning. Simple things like calling someone by their name, asking about their favorite music, or facilitating a phone call with a grandchild help make facilities feel more like communities and less like institutions. Elder care is more than just managing medical needs. It's about honoring lives, stories, and virtues. As nurses, we have the privilege and responsibility to push back against ageism, support growth even in later life, and transform care settings into spaces of dignity and connection. Thank you.